Welcome to the session on EPR training. My name is Dr. George. I work as a consultant at Trafford Hospital, and hopefully over the next 15 minutes or so we'll go through the salient features of the EPR system that we use at Trafford. So GraphNet is the electronic system that we use, and this has been in use in Trafford since 2004. It is possible that over the next couple of years, and some of you may witness it, a new EPR system may replace GraphNet, in which case I have to do this presentation all over again. There are many advantages to the EPR, and those of you who have worked here before will know that all patient records, including investigations, letters, results, are all in one place. The big disadvantage with any electronic system is that the system is only as good as the support that it gets, and if EPR crashes, then unfortunately all our eggs are in one basket. It can be slow, and some parts can be disappointingly slow, particularly when you are in a hurry to finish clocking. Certain parts may stop working, and this may be due to maintenance work that goes on. Now, just to highlight how we get into EPR, you can see on the screen there is a Trafford system on home page. When you click on that, you go to the Trafford systems. There are a number of systems here, all of which you don't need to use. If you focus on EPR, that's the system that we use. When you click on EPR, you get a login page, and you will be provided with the login details. You'll have a username and a password. It is important to remember that this is different. This may be different from the login name and password that you have for the Trafford computers, which might cause a bit of confusion and getting used to. Once you log in, you then get a pop-up which tells you any updates that might be happening. Scan through it before you move on. When you click on OK, you then get a list of all the patients that are admitted. You can get this list tailor-made to your login, and you might notice that there are some icons at the top here. Using one of the icons here, you can actually make sure that when you log in, you get the list of patients on your ward. When you click on any particular patient, this is the opening page that you see, and you might have noticed that this is a fictitious patient. This is on the trial system, but this is the opening page that you see. So let me just go through the icons here. At the top there is a folder icon, and if you click on this, you will get 4 options. The first one will be all the inpatients that are there, which is predominantly what you'll use. The second one gives a list of all the outpatient clinics according to consultant that is happening on a particular day, and might be helpful particularly if you want to see if there are any clinics that you want to attend. The next icon here is to search for patients, and you can search based on name, NHS number, date of birth, and even postcode if you know the postcode of the patient. You can print pages, which is this icon here, and I'll come back to the icons that I've missed in a little while. You can print. This is useful if you are sending the patient to a different hospital and you want to print out any sections on EPR. On the left hand side you can see that there are quite a few tabs here. There's patient information, which usually gives you, when you click that, it gives you patient details. It also gives you the name of the GP, and also if the GP has allowed the hospital to access, you might get a list of medications which might be useful. If the patient has diabetes and is under the care of the diabetes team at Trafford, you will get a diabetes folder. Now that can only be created if the patient attends the diabetes center. So if it is not there, it does not mean that the patient does not have diabetes. If it is there, it only means that the patient did attend the diabetes clinic at Trafford Hospital. If you want to see the summary, just click on the diabetes icon and you'll see a diabetes summary, which will give you a list of medications and the most up-to-date comments from the diabetes team. What should really be of importance is the inpatient icon here, or folder here, and once you click that open, you will see more details of the patient's admission. Now we are on a live patient, and you can see this patient has been admitted several times during the past few years, and all the records, including discharge summaries, clocking, proforma, all that will be available on the electronic record. When we move further down, you can see that there are two unopened folders here. One is create new documents and the other is analysis. Create new documents is where you set up clocking proforma, immediate discharge summaries, if you want to make a referral to another consultant, if you want to request a gastroscopy or other tests. All these are under create new documents. Analysis gives a graph or a list of previous investigations, and we'll come to that in a little while. Now I have opened create new documents, and you can see new request, which is for investigations. New note can be used if none of the clocking proforma or inpatient stay notes are working. You can use this facility to put a note. Unfortunately, it won't be formatted, so it will look a bit jumbled up, but at least you've put in a record that you have visited the patient and made a change in management. Going down, clocking document is here, and if you notice, when you press on clocking document, this is what will open up. Press on inpatient admissions and you will usually see the name of the consultant under whom the patient has been admitted. Click to select, and then going down, open clocking proforma, and then press create form. When you do that, a new form will pop up, which is the clocking proforma. Now if you look at the top left corner, there is a column here which looks blank, and this has proved to be very frustrating for people who do not know it. You cannot save the clocking proforma unless you choose an option here. So this is usually the option to choose is a medical patient, sometimes ambulatory care patient, but you need to make sure that you click on that first. Once you do that, you can then move further down, and you'll come to five different sections. The VT assessment, most patients will be low risk, and you can just click that. However, if there are patients who are high risk, you can click on this button which will open up the page for filling out a few more columns. These are all tick boxes, so it's filled very quickly. VT assessment is really important for all patients who are admitted, as this will be recorded as a black mark against the consultant if the VT form is not complete, and the consultant may come back to you on that. Clocking Proforma is next. You can only open it in sequence, so you have to do VT assessment first and then move to Clocking Proforma, subsequently down to prescribed medications, and only after you click a button on prescribed medications can you then open post-take sheet. So moving further down, this is the Clocking Proforma. You need to fill in the main condition. You need allergy, history of presenting complaints, and there is an examination column further down. Unless you click all that, you will not be able to change the red marking to green, which is suggestive, which indicates that the form has been completed. It's wise to put a clinical impression and a management plan, as the nurses often go by this for their handover notes. The registrar or a senior person will need to review the patient as well. You can see that for this patient, the VT assessment has now become green, where Clocking Proforma has become green, prescribed medication has become green because I have clicked a button which says that I do not have the list of current medications, and now I can open the post-take sheet. On the post-take sheet, it's really important to put a consultant diagnosis, as coders will come back to you if you have not completed this section. They can only interpret what you have put in, so always put treat as something. You are going to make a management plan based on a presumed diagnosis, and you can put treat as pulmonary embolism, treat as angina, treat as exacerbation of COPD. Even if you're not sure of the diagnosis, it's perfectly fine. You are allowed to have a differential diagnosis, but you will be treating as a diagnosis. So put that down as your main diagnosis. This is a form for requesting investigations. As you can see in the top here, there are several investigations. You can do radiology and cardiorespiratory investigations, as well as gastroscopy. All that can be done on this page. There will be further guidance on how to make sure that you print out on the right page, on the right printer, which is often a cause for frustration among some doctors as they learn the system. This is how you get a graph of all your previous all the investigations in the past. So I've chosen to look at the last 14 investigations. You can look at the last 200 if you so choose. So top tips, number one is use the graph. Past results are often very helpful. Always save after each step, and it's very frustrating to lose your typing. Alternatively, there are some who just type in on Word and then copy and paste. Sometimes you can't open Clocking Proforma. Don't worry too much about it. You can put clock on inpatient stay notes, but come back to the Clocking Proforma just to make sure that the VTE document is completed. If what you have typed has disappeared, try to right click and do an undo. Alternatively, you can do a Control V and let you read the rest. You can only do the post-take if the clocking sheet and medication sheet is complete. Error messages occur, but don't worry too much about it. These are often just glitches in the system. They will be saved. Please sign off without exception, and everybody who's admitted to AMU will require a discharge summary. Thank you very much for your attention.